problem with all the side effects, how would you recommend someone to take it? When is it recommended?
On the first day, on the third day, on the 10th day?
Oh, we are looking at people.
If you must take it. Yeah.
Let me ask. Are we looking at this example you gave me? The person is coming on Friday and then
exactly.
Yes.
And leaving on Monday morning.
Leaving on Monday morning.
So it's still 72 hours. Because he's coming on Friday evening. Leaving on Monday morning. So me, I'll do the math. I'm like, okay, Friday evening to Saturday evening. That is one day. So he may even leave Monday afternoon. Hi guys, welcome to yet another episode of Purely Candid. So in today's episode, we are going to talk about contraception, to be specific.
Yeah.
And we have the presence of a medical practitioner, a very good friend of mine as well, Dr. Hilda. So Dr. Hilda, I'll give you the floor to introduce yourself.
Hi everyone, my name is Hilda Amolo. I'm a medical clinic officer. We are going to interact. It will be an interactive session. Enjoy.
Thank you very much. So Hilda, what is contraception?
Contraception.
Slash
Okay.
family.
Family planning.
Oh yes.
Yeah.
Contraception,
Family planning, I think, is
too
the
much
most
science.
known.
Too much science.
Yes. What is
So
family
we
planning?
can call it family planning. Family planning, it's just the way you understand it. But then, to me, it is the deliberate use of, let me say, artificial methods or devices to avoid pregnancy, because you go for it when you know you want it, and you're going for it because you know why you want it. So it is deliberate.
Okay.
Yeah.
So it applies to someone who is sexually active, or if I'm not sexually active, should I be concerned about contraception?
Yes.
We are deliberate avoiding pregnancy. So how do you get pregnant?
By drinking water.
So if you're not sexually active, you don't need family planning.
Okay.
Yes. So if you know you're sexually active, then you deliberately go for that, because some people are sexually active but they don't go for it.
Exactly.
Okay.
Yeah.
So why is family planning crucial?
Family planning. We all know why we need birth control, because people go for sex. It can be used for pleasure. Not everyone who goes for sex, they want to maybe give birth or get pregnant. So since I want to get the pleasure, by the end of it all I don't want to get pregnant, it is a mode of not getting pregnant.
Okay.
So other people, depending on the age group, like when you look at pills, as we shall discuss deeper and deeper, we shall get to know about it. If, for example, a lady is having cervical cancer, or if a lady is having the bleeding issues, we have those ladies who bleed in the middle of their periods, who have heavy bleedings, like generally bleeding disorders. We end up giving them the pills. Not to use
help
as
the
family
bleeding.
plan. Exactly. So they are taking as medicine.
Like hormones.
Thank you. Because those pills are artificial hormones. So this time around, we are giving you pills not to prevent the pregnancy. It can do it. But then you have another indication of it. For example, you overbleed. Maybe you have the painful menses.
It's very painful cramps.
Exactly.
I've heard of that as well.
Yeah.
Okay.
So some people go for that, not because they want to control the pregnancy, but because they are treating medical conditions.
Yeah.
Okay.
Yeah.
Okay, so Dr. Hilda, tell us what types of family planning methods are there, and maybe what are their side effects as well.
And effectiveness as well.
Effectiveness. Before I always advise my people, before you go for any family planning method, please, age group. Do you have children you don't have? There is what you call,
that is important as well.
very
Now,
very.
talk to me.
Okay.
I don't want to reveal my age, but 30 above.
Above
Okay,
over
no
that.
child.
No child.
No child,
Yeah.
but you have hopes.
Yes.
Soon, because the
So
program
not very
also
soon.
matters. You may be looking at a child in 5 years to come, a child in 1 year to come. Someone can be 6 month period, but before that 6 months, I don't want to conceive.
Exactly.
Those are two different people. So if you're choosing a family planning method, look at the period. We have the, let me start with the natural. Natural, we all know the natural ones. You don't need to take anything anyway. We shall briefly go through the natural methods.
Okay.
We have the hormonal methods. They artificially manufacture hormones and probably maybe in the pills, maybe in the injectables, and then we administer that thing in your body. So we are giving you a hormone that is like the one you're having in your body, you get. So those
What
are
do you
hormonal
mean,
methods.
like the one you're having in your body?
So
We have-
is it estrogen?
Yes, we have.
Progesterone.
You passed science.
She's a scientist. Hey, some of us are art students.
I know. So when we say estrogen, you get lost.
I get lost, yes.
So when we say hormonal methods, as a woman, every woman, when we reach into our adolescent stages, we have hormones. Some hormones rise, some hormones lower, like depending on the situation.
Okay.
Like the hormones that fall when you're pregnant, the hormones that increase when you're into your periods, when you're almost there, you get. So what these guys do when we say hormonal methods, if we want, maybe you may find some methods have estrogen, some are combined, they have both estrogen and
So, for my auntie in the village who doesn't know what estrogen is, could you just dumb it down, explain it in the simplest term possible?
Okay.
Yeah.
To someone's aunt in the village, if I say hormonal methods, this is a method where they are going to inject you something. It can be an injectable, it can be a tablet in your body that is going to cause an effect, like something you have already in you.
Okay.
You get,
So what does
So-
estrogen do? What does progesterone do?
Yes.
And these are female
We shall-
hormones,
we
right?
shall
Oh,
get
both of them
there.
are female hormones?
Yeah, they are.
Okay.
Of course, we are talking about the female body.
Okay.
Yeah. So we have, on the other hand, we have the non-hormonal methods. We have the non-hormonal methods. We shall list them and briefly talk about them. Then we also have the permanent. Permanent is something for all and
Like there is no turning back.
there
You
is no
can't change
turning
your
back.
mind. Oh.
So if that's why I told you decision when you're making a decision.
Yes.
So like Nadia, you can't go for permanent.
No.
I mean, you're about to have a child. Yeah. So when you're making a decision to have a family planning method, please engage your medical person or your doctor or anyone you're talking to. They should explain to you. You need to understand what you're going for, the side effects, and all those things.
Yeah.
They are very necessary.
Okay.
So briefly, those are some of the methods on like some of the methods we are going to look at when we are breaking them down.
Okay.
Yeah.
So let us start with I think the natural methods.
You're interested in natural methods.
Yeah.
I can see. Do you want
We
to
don't
know
want-
Biggest percentage
We
of
don't want
us-
artificial things in our bodies, but also we don't know
People.
the effectiveness. So now, in your explanation, you will tell us how effective
Are
they
we
are.
playing it safe
people
or
people
are we
of your age
risking?
group?
Yeah.
I don't know whether you can do natural anyway.
We shall decide in a short while.
all right. Natural family planning methods. Let me start with this one. Someone I quote talked of abstinence. You guys, do you buy abstinence as a method?
I practice it. You said that it's a conscious
Consciously,
decision.
yes. There's sometimes
decide.
when
Why?
it's just a dry spell. The men are not coming.
Let me-
You're not attractive. You're just there poor.
Okay, let me clarify this.
Yes.
When you talk of a method, that means you've chosen that route. So you're not abstaining because you don't have a man.
No, I've chosen to abstain. Me, I'm abstaining from sex. As
Because
birth control
Even
method.
the man is around and you're
Hey.
abstaining, then it's a method. All right, so abstinence is totally doing without sex. How many can do that? So I don't
Priests
know. Do we need
and,
to talk about
and
it?
nuns
Yeah.
can do
Someone's
that.
lying there.
I know, it's lying.
Someone's lying. So, but
Okay.
people do practice. People do practice. I'm very sure some do. For years anyway.
Yeah.
Yeah, when they're abstaining. So it is the perfect method.
Yeah.
I can't say.
Perfect.
And I know people beat me. Okay. We leave that. So leaving abstinence alone, we have what you call fertility awareness.
Okay.
Ladies, you have to know your fertile days. You have to know when you're fertile.
So how do you know
have to
that, by
when
the
you're
way?
not fertile.
And also break down for us what are the fertile days, what does
Exactly.
the cycle look like.
Wow.
We're talking
Yeah.
to someone who may not even know.
You guys, you
I
want
don't
to do-
know, by the way, because I just use the app on my phone. It thinks for me.
You think it's a
but
perfect
now,
app?
Questions can be raised.
that is the question. Now that's why now Musao has to teach
Anyway,
me
that is
so that
I
I
think
know.
a calendar method.
Oh,
So, anyway, fertility awareness. How do you know that you're fertile? Nadia? How do you know
I
that
think
you're
a
like
pimple
my
comes.
ovulation days. No, I think pimples come towards the period. So maybe what
not
I
by
know,
testing
what
and then
I-
you conceive.
Uh-huh.
Before you go to that, how do you know that you're fertile?
regular periods.
Okay.
Is it a sign? 'Cause I think it shows like your hormones are.
Now me, I was talking
well,
about
Okay, having
ovulation.
periods.
Yes.
Continue, you can also give us
Uh-huh.
that.
For me, I was thinking about ovulation because the moment I finish my periods, I know I have the safe. I know it's 14 days, and then 7, and then I don't know. Anyway,
You're
please
telling
teach
us your fertile days, but
Yeah.
how do I know
That you're
I
actually
can
fertile.
conceive and hold a
Is it
baby?
not
My
by
periods.
checking, going to be checked? Because you can't tell by just having a period that you can actually
fertility
conceive.
awareness, you can listen to your body. Our body communicates.
How do you listen to your body?
When you get into your periods, you name that day number 1 of your cycle. So of course we don't all get into our periods on the
Same
first
time,
day
yeah.
of the month. So it can be 18, it can be, we can
This
get
is
any
a
sample.
point for men to know. A period doesn't come like a monthly cycle.
Exactly. Men think from the 1st to the 5th,
I hear.
she's in her period.
Uh-huh.
All the other days, I want
From
some.
first, okay, for
Let
example,
that- it's
first
not
of
a calendar
August.
day.
No.
Let that.
No, we are different.
Exactly.
We are different. Many should know this. We are different. So the difference comes in like this. I may get my periods on 19th. She gets her periods on 20th.
Yeah.
For you get your periods on 2nd. We all have cycles and we are normal.
Yeah.
So for you who gets your periods on 2nd of every month, okay, probably it cannot be consistent sometimes,
Yeah.
but let's
But
take the
around
example. Okay, 2nd of the month. That is the first day of your cycle. That is how you know that my cycle is 21 days, 28 days, 30 days. We have different cycles.
Yeah.
Hope you know how to count the
No.
length of the
Me, I know
cycles.
mine is a 30
For me, I
day
don't.
cycle.
I have no idea. Like the
From
app,
when you first
has the app has spoiled me. I just put and then it notifies me tomorrow
Because
you're
the cycle
starting.
also, the
That is
app
it.
also asks you how long is your cycle.
No,
Exactly.
I just
Don't
put
The days between your first period and then your
Don't
next
you
period.
feed in some information?
only the very first time you're starting.
Yes,
After that, I've had it for years,
How long
so
you have
I don't
your
know
period,
anymore.
how long
Because
the cycle is.
I think the first time I got it
uninstall
wrong,
the app.
and then that's why I'm learning now. Yes.
You need to install the app because it's going to mislead you anyway. We can use our body temperature to know whether we are ovulating. Exactly, whether we are ovulating or not.
Do we get hotter?
Exactly, we get
Very
hotter. And
hot. You don't feel it?
the libido
I don't know.
increases.
I think I listen to my body a lot because I can know.
You can know when you're ovulating.
Yes.
Yeah. So your temperature changes, it rises a bit. Men like it most because
You're warm down there.
the whole body is warm generally.
The whole
so
body.
Yeah.
exactly. So you can as well use your cervical mucus to tell when you're fertile. Most of these are hormonal methods. They act by thickening the cervical mucus. So when it's thickened and maybe you're having a man and then he releases, that means
Can't penetrate.
exactly.
So,
So
the
during
sperm can swim
ovulation,
properly.
it is thin. So sperm can easily penetrate through.
Oh.
So you can get the discharge.
So as I'm washing myself and it's very thin, I know.
You even feel
Really
it.
cool.
idea, not only one, you have to combine all the
Yeah.
so that you have the answer. Yeah. So
But is
another-
that really a sign of fertility, Hilda? Or is it just a sign that my body is ovulating?
of course we are looking at ovulation.
So does that mean that I'm fertile?
The fertility, I think
Because me, I think
said
fertility is
if
my
you have
ability
a period.
to first of all conceive
hold a
and then to
baby.
carry a child. Yes.
And so conceiving is a process. We begin from menstruation, from ovulation. So that whole thing, the hormones that interact there and all that, they end up giving you a baby. So that meant you, of course, not everyone who maybe menstruates is fertile.
Exactly, yeah.
But at least it's something.
It's a
When you're
sign.
still growing and maybe it's your menarche is the first period. So when you've just gotten into,
Exactly. I'm a woman.
And our parents used to tell us the moment you mess with a man,
Exactly.
anything can happen. So
I
it's one
remember
of
my first period. I want to just reflect. I swear, I think I was in high school.
High school?
Yes.
I was in P7.
Are you kidding?
You're so
I was
fertile.
Senior 3, you
12.
were. Senior 3.
Wow.
Senior 3.
But you
15.
did
I was
rest,
15.
I was 12. I was 11.
Wow.
15.
I was 11.
Us
I
late
very
bloomers. So I was just on countdown because all my friends had.
So you're the
I was
only
like,
person
man.
who
15.
When
I
is
was
it?
in
When is
senior
it?
3.
I was
had
so
been
So
happy.
you got yours at 12 years.
At 11, actually.
11
Yeah.
Are you
At
kidding?
11 years, yes.
Your parents raised you well. You are eating good food.
But we
She's
were
just
raised in
ready.
the village who are not Kampala kids who are taking Cerelac.
You're just
and
very
yeah.
fertile anyway. Then another trick about fertility. Let me just drag it a bit. Some ladies experience 2 times their periods in a month. Are you aware of that?
Someone
Right now is suffering.
Yeah,
But
someone
that-
right
maybe
now
that
and
was
she's
someone else.
scared.
So guess
As-
if you're the man, you've married this woman. The woman is maybe having, let me say, 4 days each period. I mean, each time she goes into her periods. So you have to wait.
So it's like a short
if you're
cycle,
the person,
right?
it's a short cycle. We don't even advise them to 6 days because they have this.
Oh.
Okay.
So it's one of the things we can gauge that person is fertile.
Okay.
Because as you're releasing, the egg is being released.
Wow.
You get it. So it's just even there are some people. In order for you to get pregnant, in order for a couple to get pregnant, they can be married for long, but then they're not conceiving. It's just a matter of reading their cycle. Some women they can even ovulate when they are menstruating.
That's true.
I've heard of it, by
That's
the way.
facts.
Is that normal?
So you sit them down. Your man has to be. So Orumba when the person is in period.
Hey?
It is the way to go. You want a child,
Yeah.
right? Yes.
So is being,
But then how do I know?
is being
I am-
horny a sign of fertility also? Because during ovulation, ideally you have an increase.
Wow, some people are naturally horny, but then
Yes,
Yeah,
some
that
are naturally
increase.
horny, by the way.
That increase.
Wherever you're
yeah,
just
of course,
battery ever ready.
during ovulation, it increases a bit.
You
But
know,
then
we are like
some
animals
women,
when we are in our ovulation days.
Yeah, battery
We are
ever
literally
ready.
like animals.
Yeah.
some women are beyond anyway. But during ovulation, you're horny always. Your libido increases because of the changes in the body and then the hormones. Just something to play around with hormones.
Okay.
So you're right. If you get horny, you're normal.
But then
Yeah,
my
the body is
question is,
communicating.
Yes.
how do I know I am ovulating if I'm menstruating at the same time?
That is-
The people who ovulate
Those-
in their
You're
menstruation.
not one of them, but those guys, of course, for you to know that it happens like that. I'm married. I've been married for 2 years, for example. I'm not getting a child. Of course, you take caution. Be like, why am I not conceiving?
go
So
see a
you visit
guy.
different hospitals. Of course, that is
And they
part
tell
of
you
the-
everything is okay.
Of course, they first do that test, but part of the history, that's why history taking is important when you're one-on-one with a patient. So you get to know their period, their ovulation cycle. It is important. So that one is captured during history taking. So you just can't enter into a marriage and not tomorrow I'm going to conceive. No.
So
It's not that black
is
and
there like an ovulation test which can be done? Because, for example, me, I don't know my cycle. I have an app which has thought for me for so many years. The first time I put it, I think I got it wrong, but then afterwards it told me enter your first day of the period, and it was that day when I started. So the moment I put, and then the following month it told me to again enter, and then I think it like auto calculated. So since then I don't know my cycle. So like, is there
told
a
you
test
uninstall
for the
that app.
cycle?
Yeah,
I will. After
She
this
should,
session, I will.
Okay, when we are dealing with infertility, we look at hormones. So that test, the one you're calling ovulation test, it's not called ovulation test. They look at different hormones.
Okay.
We know this hormone is supposed to be like this, the normal
This time of the
ranges.
month.
Yeah,
Yes.
yeah.
So they just do the hormones in your body, and then they can make a conclusion afterwards.
Okay.
So you can't point out that this is an ovulation test now. It is you to listen to your body. You can do it.
And
So
we're kind of digressing, so we should first come back to fertility, the natural way
yes,
of
whereby she was
monitoring
saying
your
you listen to
there is
to your
temperature
body, yes.
increase. There is cervical mucus. You monitor your cervical mucus. You can feel it.
Yeah.
as you're showering, you feel if
it
it's
is,
thick or
And because I think
Even
after your period
the-
you're a bit dry usually.
Exactly. And during
those days a
ovulation,
bit dry.
the discharge is a bit
More. Yeah.
you get if you take caution, you can feel it. So you don't
maybe
need
I'm
to-
just a naturally horny human being.
No,
Because
it's
I feel as if
funny,
the
but there's-
temperature is high all the time.
your
The
body
mucus
boiling
there
is
all
the
time.
up only.
By the way, the app is
Seriously,
is
so
spoiling me.
we have all it takes to listen to, but some people get the pain. Me, I can even
Ovulation
feel the
cramps.
side where it's coming from during ovulation.
Oh,
have a
by
friend
the
told me she can
way,
feel
you feel
the
like a
egg.
tiny prick,
Thank you.
Yeah.
like
So-
like it's so painful, and you're wondering, am I cramping?
I
but
know, like
but then I couldn't finish
cramping,
my
eh?
peas.
That is ovulation. So you can know when you're ovulating.
Oh,
And you can clearly listen to your body and you can tell I'm ovulating, I'm done with. Some people get breast tenderness.
Yeah, me too.
You feel your breasts are tender. Some people get the same thing when they're pregnant. Some people get it when they are towards
their period, yeah.
Exactly. During ovulation, their breasts are always tender.
okay.
They are
Okay,
always
so those ones are the natural methods.
Yes.
How about withdrawal?
tender. Hey. The men in the house.
The one that the men like them.
You
Maybe
As
I'll
is
pull
always
out.
coming, you don't grab him.
I wish we had a man here. They could answer that question, but men don't like that method.
Are you serious?
I
thought
know.
That's their preferred.
No,
Wow.
because
They
he is climaxing. He doesn't want to be
can't.
interrupted.
You can't
Look
like
at the boys.
But you tell him to use a rubber, and you see.
By the way,
No.
tell him to
Hey.
use a rubber. It's
Hey.
even worse.
So you tell him to choose, eh?
But here's the way my
Okay, if you happen to ask the man to choose,
Yes,
you called it a rubber, between a rubber
and withdraw.
and withdraw.
So men in the house, what do you choose? Anyhow.
Sasa
But after,
kunyama.
you have to remove. Is it clear?
Hey,
they don't
so you have to
remember
pull
it.
it out
And
before
it out.
finishing.
Yeah.
Hey.
You guys try withdraw. You're risking, especially the ladies. These men are going to lie to you that I'm going to.
Oh, by
At the
the
end of
way.
it all.
Yeah.
Or
It was
sometimes,
too sweet, I
by
guess.
the
I
time
know.
they are coming out,
But after
there
they
is
say
already
sorry.
something which has already entered.
I was
in.
about to ask about that something.
They
The
said
pre-cum.
sorry, and
This
then-
pre-cum, does it make a woman pregnant? So before a
The
guy...
pre-ejaculation.
The pre-ejaculation.
During sex, they are rounds, right? So you can have sex. That is the first round. You guys tend to clean each other. Yeah? Can you clean and reach everywhere?
No.
How do you clean?
We have to ask a Muganda with their enkumbi. Senkumbi.
With
How do
the
they
Muganda
clean?
They are not here.
Oh, so you mean say it doesn't
So after there, we expect the second round. So that's why I don't always advise people to do withdraw. You can mix them. Okay, you can maybe count your days. You're not sure. You tell him, please, we do this. But looking at it as only the method you're
So,
depending
yeah.
on, it's risky.
But
It is very risky.
in our days of campus, before P2 became common, it was either condom or withdrawal.
My
Because
dear,
P2?
you people,
Postina 2.
let me tell you one thing.
Hey.
Over that time, God was just on people's sides.
God was on our
Let me tell you
side,
right now,
you
if
guys.
you try the
God
method,
was so much on
my
my
dear,
side.
they will not work for you. But back then, they used to work.
They
Perfectly, because you couldn't take the postina, but
Yeah.
then the guy maybe does the withdrawal and things work out.
Yeah, and things
And
work out.
for months, for years,
But
and
broke,
For years,
broke
by the
men
way.
know how to withdraw.
Black men are sharp.
Oh.
Okay, so let us now go to
Hilarity.
the hormonal methods, right?
Okay, yeah. So let's switch to hormonal methods. With the hormonal methods, we have the pills, we have the injectables, we have the implants. So, and we have also the hormonal IUD, which is not so common, but then just keep it at the back of your mind. You have the hormonal IUD. So the commonest, let's just look at the common things that they are. At least you call it, your aunt in the village can access. Yeah, we can start with anyone choose. I talked of the pills.
Let's start with the pills.
We start with the pills. Okay. Among the pills, we have the known ones, emergency. You know all the brands.
Oh,
right?
emergency contraception pills.
You have
Most
all-
preferred for Kampala girls.
you
Which
know-
everyone tells you it's also the worst for your body. Is
The
it?
Kampala girls say that.
No,
No,
the
they're
doctors
fine.
tell you the
I
emergency
thought the
contraceptive.
Kampala
No,
girls. I was
the
going to
Kampala
tell
girls
you.
are quick fix. Yeah.
Like chewing, you heard this
like chewing
gum.
gum, they pop it like gum.
If they knew the amount of hormones in that pill, anyway,
Yeah.
it is after 6
For me,
pills.
honestly, the times I've used that pill, always my period.
They are
Disorganized,
altered,
yeah.
They are
Disorganized
altered. It is
it.
possible. So looking at the pills, we have the emergency contraceptives. I think all of you know all the brands on market.
Yeah.
You know
Yeah.
all?
No, I don't know
I know
all. I only
Postina
know
and
that
then some
common
other
one.
one
The
I
P2.
tried.
Okay, the P2.
The Postina too. Is the only
One
one
of
I
my
know.
friends told me it
And you?
backfired. It didn't work. She got pregnant.
She
Which
probably
one?
took it late.
Anyway,
No.
for the audience.
Emergency contraception is
That
always
brand
success.
should not. Anyway, it could be. We can't blame the brand,
It was
but even
expired.
her, not even her. How long did she take?
Exactly.
She took it. Apparently, she took it because she was.
That is
not
what they
wanting to
will
have a
tell
baby.
you.
You know?
Up until
Let me give you this example. Maybe I'm going to. I hope to have sex. Maybe 3 days from now. So that day comes, I have sex. I don't take maybe the emergency pills because I'm going to have more and more.
yeah, exactly.
So you
So
get
like,
so you take it at the end thinking even the first thumbs are waiting for you. They're not
Exactly.
waiting for you.
Exactly.
So anyway,
By the way, that is
my
what
God.
most of the
Exactly.
campuses
I would just
do.
want to do
Exactly.
that.
Because
Instead of
these
taking
guys
it
are not
every day
married.
for
Like
3
we're going to
days.
have sex today, tomorrow, and Wednesday.
Yes,
Why
no.
not take the pill? Maybe
At the
like
end
on
of that-
Tuesday.
No, he's
At the
coming
end
on
of that
Friday.
session.
He's leaving on Sunday or Monday morning. So I'm like, okay, Friday, because we are always told it is effective for 72 hours. So I'm like, okay, Friday we go, we swim. Saturday we swim. Sunday we swim.
Then you take
then
Sunday
Monday
evening.
morning, as he's now leaving, then I take
It will work for all the other days.
then after they blame this is
Exactly,
this
the
brand
brand.
doesn't work with you guys. We have
You know,
to take
Chiwani.
caution, Hey, by the way, they end up even not going for that brand anymore, not knowing it's them.
It was their
with
fault.
them,
Yeah.
So we have emergency. We can
So
list a few brands.
what
Let's
exactly are the
before we
side
continue.
effects of this emergency?
Even before the side effects, how would you recommend someone to take it? When is it recommended?
Aha, on the first day, on the third day, on the 10th day.
Oh, we are looking at people.
If you
I mean,
must
if
take
you
it.
must take it, yeah.
Let me ask. Are we looking at this example you gave me? The person is coming on Friday and then leaving on Sunday.
Exactly.
Yes.
And leaving on Monday morning.
Leaving on Monday morning.
So it's still 72 hours. Because he's coming on Friday evening, leaving on Monday morning. So me, I'll do the math. I'm like, okay, Friday evening to Saturday evening. That is one day. So he may even leave
guys
Monday
are
afternoon.
serious
And I
with
really
life,
like that.
Feel that these things happen.
Happen.
Not
Serious.
everyone
Yes, I
reality.
know, but
They
that is
happen.
you guys. Anyway, have your sex Friday night. Please take the pill in the morning, the following day.
So does it work if I have sex again the next day?
Take the pill the next day.
Again?
No, not
Hey.
again. We are having sex Friday night. That means Saturday morning. I'm supposed to take a pill. How do
Then
they?
Saturday night again.
How do they work?
Hey.
How do they work? We go back to how they work. You get? They are inhibiting ovulation. So if I took it earlier and my ovulation is being inhibited.
I thought it kills.
Me
it
too,
kills
I thought
the
it's
embryo
after.
or something.
Wow!
Actually,
you
thought
kills the
it
sperm.
kills the sperm. That's what I thought. It just kills the
But
sperm.
there is a lot of.
Oh
I know
my
you can.
goodness.
Yeah, so
Misinformation.
take it on the first day. Let it do its part. It's already when you saw it in your body, it's already doing its part.
So what exactly are the side effects? Because for me, my worry is there are some people, okay, I may start taking a week early and then it tanks my sex drive or it makes me dry or something, and I don't want all these things. I've been waiting for 6 months.
So before we go to side effects, Hilda, how do these pills work? Then you cannot tell us the side effects, like the normal regular birth control pills.
Are we finishing? Like we should capture everything together, or
Start with
You
how
tell
it
us.
works,
You tell
and
us.
the side effects.
emergency contraceptives. They inhibit ovulation. If you don't ovulate, are you going to conceive?
No.
Simple. So if ovulation is limited, I mean is inhibited, you won't conceive. But people having sex beyond what we've talked about, go for oral pills. Go for the pill plan. You get it's better than you can't take emergencies every day.
So how does the pill plan work in the body when I take it? I'm taking it for 1 week prior to sex.
We are looking at the pills. The pills, when you're taking the pills, it is still the same thing because you're looking at hormones. So they are going to inhibit your ovulation still. But then remember the milligrams in the emergency pills, it is higher than the milligrams in the normal pills. You get. That's why we're giving it like a week so that your body gets ready. You get.
Okay.
Yeah, adjust to what is coming.
Yeah.
So that's why the emergency works instantly.
Okay.
You get.
Yeah.
But still, the mechanism of action, it's almost. We are looking at still our cycle. We just play around with our money cycle in things to do with family planning. Yeah.
And the side effects I don't know if it's true that it makes you dry, it makes you
Because it's playing with your hormones.
whatever.
What happens in the
what
body?
are some of the side effects?
Anyway, we are looking at the good part of it. I mean, you're going to have your pleasure without the Cavero rubber or anything. Of course, you're going to enjoy, but then, at the end of it all, you still have something to pay for. So, some people can get nauseated. None of you have ever been pregnant?
No.
I was going to tell you to share the experience, but then you can feel nauseated. You can also feel the headaches. Your cycle can alter. You talked about it. It can either push or it can come earlier than expected if you take them. So we expect that.
Does it make you dry? Or does it make you horny?
Anyway, when you talk about side effects, we give you a general view.
Okay.
It doesn't mean everything
Everyone.
listed you're going to get it. But some people get all.
Oh.
Wow.
If you're unlucky, but some people get a few, it doesn't mean that you're going to get everything.
Yeah.
Okay.
The way it has been listed, but we have to give you a general picture.
Yeah.
So that in case it happens, you're not
At least
out.
you know what to expect.
Yeah, you know what happened.
Okay, so the pill was the first hormonal method. Which other hormonal method?
That is the emergency pill. So we go to these normal pills. I call them the normal pills because some people call them the family planning pills, and the emergencies, I think it's given another name anyway. So we have what you call COCs. COCs. It stands for combined oral contraceptives.
Okay.
So it has two hormones. It has estrogen and progesterone. Then we have the progesterone only pills. It has only progesterone. These pills are targeting different people. Different people with different maybe conditions, maybe medical conditions. You may have a medical condition, you're ready for the pill, then but your medical condition can't allow you to take a pill.
So in other words, I shouldn't just go over the counter and self-medicate. I just say I want this kind
First
of
have
pill.
a session with your doctor, choose a method. Then they can continue with over your counter because it shows this because of ABC.
Works for my body and my
Yes, not
condition,
just
whatever.
I had my friend use this and go for it.
Exactly.
People crash because of that. Yeah, because you heard from a friend. So going straight to combined, that is COCs. I'll be using that word. So those ones are, I think they are fit for all of us. If you can remember, because there is that, it is a daily thing.
It's like it should be on
So
it for
you
the
set
whole
an
month.
alarm. That's why by the family planning things of two. Most methods affect ladies, unfortunately. We are so unfortunate. But then you should engage your husband.
Yeah.
If at all he's positive about it, because some men are not positive. At the same time, they don't want you to conceive, and then you're like, what is this? Because, for example, I can use a method, then my libido comes down, and maybe he can't continue yes, to bear with that. So you tell me, get off that method. At the end of the day, we have to protect ourselves. So what do? You get? So if you see your man is not maybe speaking the same language with you, but it is things of two. So if you have your husband, he knows that you're on pills, and he knows you take them at 10. He can remind you sometimes. So that we keep that track.
So it has to be the same time every single time.
If you're given medicine, and then they tell you 1 times 1, that is 24 hours. A day has 24 hours. So if I happen to take it at 10 p.m. today, to make 24 hours, it will be tomorrow at 10.
Exactly.
So that.
But sometimes I take it at 10, and then I'm like, let me just take it in the morning, and then it will cover for that. People do
Intentionally,
that.
or you forgot.
No,
Different
people
things.
do it intentionally, by the way.
It's not good. If you explain that's supposed to be after 24 hours, at least some people will forget. That is, and it is normal, but though it will affect you to some extent. If you forget, take as immediately you remember. You swallow
like
it.
in the morning. So if you remember in the morning,
You swallow in the
I take it
morning.
in the morning.
But
Then I
don't
change.
push because you think you're comfortable with morning hours, yet in the beginning you chose night. That's why we tell you choose the comfortable hours. Comfortable, you just need comfortable hours because we are taking care of the forgetting part of it.
Yeah.
So if you feel 10 p.m. is comfortable for you, go for that. Go for that.
Okay.
Yeah.
Okay, so that are the pills now. We have covered
That
pills.
is combined.
Yes, combined. And then
What
there
about
is
the other?
the progesterone.
The progesterone only. This is fit for breastfeeding mothers. If you, some men are so impatient anyway. If a woman gives birth, you're supposed to wait for her to heal, right?
For how long?
Am I
3
right,
months,
May?
6 months.
Is it 3 months? Is it 2
How long?
weeks? Is it 1
If you're a
week?
man, how long can you wait?
As a man,
If you
I wouldn't know how as a man, honestly.
there's some men
Like
who
me, I think I'd wait for 3 months.
That's too much time now.
What is ideal? That thing has to snap back. What are you talking about?
First of all, if a whole head could come out of there, what kind of snapping? Like, am I putting a fist or a-
anatomically, you have to that
Psychologically
head
and all
has to
that.
come out of you, so he doesn't make it a point for you to rest for 3 months.
3 months is too long. Me,
How long
for me, I'm
is it
taking 3 weeks.
Are you kidding me?
I don't know.
Okay, give it 6 weeks.
But also let's look at the
6
psychological part. Like
weeks.
a woman who has just had a baby, you're telling her 3
Exactly.
weeks. 3 weeks, like 1, 2, 3. Like the
But
kid.
anyway,
But have you healed? Is the main thing.
Yeah.
you guys, you're thinking about that. But imagine you have this impatient man. Of course, you go to the hospital, you give birth, and then the doctor advises you maybe this period of time you're supposed to have sex.
Yeah.
But of course, when you resume sex, maybe you go for family planning. Sometimes some people wait for period, but it's risky. We shall talk about
Oh, your periods do
lactation
not come back
immediately.
immediately.
They don't. They don't.
Because you're
They take
breastfeeding,
time.
right? It takes.
Yeah.
How long does it take ordinarily?
Depending. If there is a method called lactation amenorrhea, we are sitting. Lactation amenorrhea, it is when you're breastfeeding your baby exclusively.
Yes.
You understand when I say
Not like these
exclusively?
working moms who are.
But
working
unfortunately-
In fact,
all the
if
time.
you're a working mother, please leave lactation amenorrhea. for
No,
the
but
rest.
how about if I am still expressing it, breastfeeding exclusively? My child is not doing anything else. Does it work? Because they're not eating food. It's still breast milk. It's just in a
I
bottle.
think it's a very different like the
breastfeed
psychology.
at
of-
least 4 hours apart. Can you do it when you have to go for work?
No, I express every
After
4
you've
hours.
expressed, but
Can that
Is it the same?
does that work?
because the thing is, women nowadays, I've honestly worked with 2 people who got pregnant after 5 months of giving birth.
There is a bond.
5 months.
There is a bond when you go overgoing.com, but there is a bond.
Yeah.
There is a difference when your baby is suckling direct and then pumping. You get
a very big
there is that bond. You know, there are those hormones, like for example, prolactin hormone is responsible for the release of milk. You know, when your baby just cries, you've heard women saying,
Yeah.
"I
Yes,
think my
yeah.
baby is
My
crying,"
baby's crying,
and then
yeah.
they feel
And
the
then
Yes.
milk
comes, yeah.
exactly. So, do you think they intend it?
No,
It's just something to do with hormones. But how is your hormone related to your baby's cry?
exactly.
So what happens
that's
if
the
you
thing
get a
where-
big baby to suck the milk? Does it work? Hey, with full teeth.
So, back to lactation amenorrhea, we always advise mothers if you can breastfeed like 4 hours apart,
Yeah.
frequent as possible.
It's a natural method
It's a
of birth
natural
control.
method. It's a natural method.
So it has to be exclusive and frequently as well for it
Keep
to
the
work.
frequency and then you get. That's
Yeah.
why if you're working class, please, it's not a good method.
Most chances are you'll get your period like
Exactly.
maybe 2 months, 3 months after.
So-
Actually, most times when they come back to work, because they
They
have
get
like
their
3 months
periods.
leave, they'll get their period like the next month.
Your body normalizes. They think you're not breastfeeding because you're not actively breastfeeding.
Yeah.
So
Yeah.
So anyway, back to our progesterone only pills. We are giving it to breastfeeding mothers. This one, even if you start it immediately, it has no effect because we are looking at hormones, the effect of some hormones on our breast milk.
Okay.
So since we have a newborn, and then they have to exclusively depend on breast milk.
Yeah.
So they need adequate quantities, right? So if something alters the production, should we really go for it?
No.
So the other tab, it is combined. It has both hormones, and this one has one hormone. And one of the hormone, the other side, it
It's
alters.
already been.
Yeah, it alters milk production. So we focus on one because we don't want to alter our milk production.
Okay.
Have you gotten it?
Oh, so it's just about the milk production. It's not about at what point a woman takes it, and that one is for strictly someone who's
Breastfeeding mothers,
breastfeeding.
yeah.
It's because we are looking at two pills, the combined and the oral. The person will be breastfeeding, but then they're active, they're sexually active. Their methods, we always wait for them to heal. We give them like 6 weeks before maybe they're inserted or something like that. So if a woman can really take up a pill that is not at least altering her milk production, it is the best method.
Okay.
You're protected. You're protected from pregnancy, and your baby is healthy. We are forgetting one thing: all the methods. These methods we are talking about, they don't protect you from STIs. So, as you're enjoying, there is HIV,
Enjoy
there
with
is
caution.
syphilis, there is
all these things. Yeah.
they're sexually transmitted. They don't keep you out from them.
Okay.
If someone has them, of course you'll acquire them.
Yeah. So I'm curious to hear about the hormonal IUDs. You hinted on them.
Yes, among the wait. Are we done with the hormonal methods? And there like
Not
some?
yet. We talked of pills. We started with emergency pills. We talked about the combined. We talked about the progesterone only. So you first chose pills because I told you you chose pills. So we can either go for injector plan. There is
those are called pills?
Yes. No, they're hormonal methods. They're hormonal methods. So let's talk about the injection.
No, injections first. Okay.
Under the brand name of Depo-Provera. You all know it?
Nope.
I've heard of Depo-Provera. I have.
There is even a Cyana press.
No idea what those are.
You guys engage yourselves in this world of family planning.
Is that a plan or that is a hormone? Or that is a medicine?
It's okay. Medicine. It sounds funny.
It's a
the way
brand
you can,
name.
yeah, exactly.
Oh, it's a brand name.
Yeah,
Okay.
it's like a brand, but it works exactly like the other one.
Okay.
So the period of time we are looking at 3 months. So
It
Cyana.
only keeps the pregnancy away for 3 months.
Only
No.
effective for 3 months.
Exactly. It is effective for 3 months. So after 3 months you have to go for another shot.
Okay.
You get it?
Is it on the hand? Is it on the bum? Is it on the thigh?
It's on the hand.
Oh.
Yeah.
So they just how is it administered?
It's an intramuscular. You give it IM. We always abbreviate like IM. It's an IM injection. You give it to a woman who is not pregnant.
A woman who is not pregnant.
Yes.
Okay.
So we are forgetting to talk about the contraindications of some of these methods, because if you look at the injector plan, in quotes, of course there are different brands outside there, but let me use that one. If someone has issues with their menstruation, they're not candidates for that.
Issues in terms of irregularity or the menstrual pain.
They are irregular, exactly. They are heavy. Some people spot without even being on
Without
family plan.
contraception? Oh.
Yes, it's called dysfunctional uterine bleeding.
Like in between periods.
Exactly. You find yourself just bleeding anyhow.
Yeah.
There are even people who bleed constantly.
Like the woman of the blood issues in the Bible. In this day and
You
age,
believe her.
with all these medicines, you bleed
possible.
constantly.
Yeah,
Like your
it's
body does
possible.
its thing.
So I'm telling you, like, if you're one of such people, and then of course the way we hear this information, I may get it from you that you're doing injector plan, and I also feel I should because it's working for you. And we are different. Probably I have my issues. I've not even shared with you, but because it's working for you, I guess it's going to work. So it doesn't work that way. If you have bleeding disorders, bleeding in between periods, like people having heavy bleedings, you're not a good candidate for that method. We have the pills for you.
Why is that? Why is it not a good method?
Because one of its side effects, it brings the heavy bleeding. So you're having it and then you're adding it. Does it make sense?
So you may bleed out and die.
You will just die.
That's what
Can someone bleed out and die actually from periods? Like if you take it, like assuming that I lied to my doctor, I was not honest, and then I went on that shot, can I overbleed? And
But can you bear the bleeding really without going to the hospital?
oh, so
Because
you-
most
you
women
just become
I
anemic and
always
all that.
encounter with, the best they can bear is 2 weeks. They're like, this is beyond. I wasn't like this because I know my periods 3 days, 4 days. Why am I going for 2 weeks? And it is heavy. You know, you start even feeling the signs of anemia. You get it. You're
dizziness
losing
and
blood.
everything.
Yeah. You can't keep comfortable when you're having
Having
sex.
to wear a pad all the time.
Exactly. It's just a discomfort. So they can't keep it as a secret. I'm sure they always complain. They always run out for hope.
Okay.
They always.
Okay, so
a person with such, they should go for that pills because we saw it at the beginning. We are going to work on such issues. You get. You're doing family planning at the same time you're handling your issue.
Yeah.
You get it? So you're hitting two birds with one stone.
Oh, that's something to take away from me.
how about now the implants?
Wow, the implants. The implants, we have the ones of 3 years and you have the ones of 5 years. Hope we've all ever put it inside just underneath your hand. It's just like a rod. We've all ever seen a rod, something small.
Okay.
So how does it work? It
Like
releases.
like a tiny string like rod.
It's not string like, but a string is something very small again. Yeah.
It's thicker.
It's kind of visible. You can see it.
It's a bit
That's
thicker.
kind of
You
visible.
can even
under the
feel
thing.
it when you touch a lady who is having it under their skin. You can feel it, so it's something thicker.
Does it hurt if you touch it?
It doesn't hurt. Doesn't hurt. So how does it work? That rod they insert in you. It is the one that is going
Do
to
they
be-
cut your skin and then put it and then
It is a slight something slight. You may
Minor
not even
surgery.
realize. Like maybe slight bleeding, very slight. It's like removing it, also slight. Like cut, remove it, but still slight something you can bear. We've seen beyond this, so that is something small.
Women have handled worse.
Women handle big things, so that is something very small. Yeah. So how does it work? It also releases the hormones. That rod, it releases continuous releases. Now the injection, they are giving you the whole hormone into your muscle. So the body sorts it out. So this one, depending on the period, maybe when you put something of 5 years, it just releases continuously again.
for 5 years.
For the 5 years.
So what happens after 5 years? It stops being effective.
You have to remove it.
What happens if you don't?
Of course, you
Not
may.
effective.
You may conceive.
You may.
Yeah.
Okay. Being a hormonal method, we go back to the other point of Nadia. She feels she should conceive, I don't know, soon. She used the word soon. So if you go for hormonal methods, we also look at how easily can they be reversed? How can you go back to your
Your normal
self.
you get? So I've been preventing pregnancy, so my body carries something that is really preventing me from conceiving. So I'm ready for the pregnancy. Maybe I'm going to withdraw from that method. Will I conceive immediately?
So will
Take
you
some time,
conceive
right?
immediately?
Depending on the method you're using, you need to take caution. That's why I told you, ask. Please know what you're putting in your body, because there are methods depending also on the period of time you've used it. Because you can use that depot. When I say depot, you understand this injection. For someone can use it for a year, someone can use it for 5 years. You get. These are two different people. They all want to get babies. You may find the other person of maybe 5 years will take longer. So they always advise these women, if you're ready for the baby and you've been using these hormone methods, withdraw before.
For
Plan.
how much time before?
We are looking at 8 months and above.
Like a year.
Wow.
But not
Pretty much,
forgetting
yeah.
how long do you take on that method. I get it. That's why some methods are better in terms of, because every method has the good side
Pros
and the
and
bad.
cons, yeah.
So you weigh and see. Because we have methods when they remove today and maybe my ovulation is next maybe month, I conceive next month. And you have the methods, you have to give it time. Yeah.
So I think the final one is
Hormonal IUD.
on the hormonal side is the hormonal IUD, right?
Yeah,
how
hormonal
does it work?
IUD, it is not common. It is there, but it's not common. So when you talk of IUDs, most people look at the copper IUD. Of course, when you say hormonal IUD, still it contains hormones. We are putting the IUD the way you know how the IUD is, but still
releases
hormones.
hormones,
Exactly.
yeah.
So looking at the copper IUD, we've gone to non-hormonal methods. Hope we've not left out any hormonal method.
No. The implants, the injections, and the oral. I think.
And the pills,
Yes.
Yeah. So looking at the non-hormone methods, we can get time and look at the copper IUD. I think everyone likes that.
Yes.
Though some people fear,
Why?
phobia. We remain Africans. When you give me an injection, I know you've injected me, but there is a white treasure in my uterus, and you're telling me you're getting something inside my uterus. You know that phobia people can have.
Yeah,
So if you
they're
lack
fixing something.
information, that means you're going to leave out something maybe that would have been better for you, and you get. Of course, to choose a family planning method, it's you to make a choice, depending on the information.
Many options, yeah?
Exactly. The options are there, and there are really many. So the IUD, the IUD is a good method.
What is IUD for?
It is intra. It is intrauterine device.
Okay.
It is intrauterine. You add the word contraceptive.
Okay.
Intrauterine contraceptive device. Yeah. So they get that device and then they insert it in your uterus.
But it's so tiny. How does it block an entire uterus?
The thing is also tiny in there.
How big is your uterus?
Wait, a uterus is not a womb. Is that
It's the womb.
It is.
Yes, by the time it can carry a whole baby of 3 kg.
But you see, I think the block just the entrance, no? The entrance to the uterus.
You guys over joke anyway. It is inserted in uterus. The uterus of a woman carrying a baby isn't the uterus of someone who isn't carrying a baby. If we measure uterus now and your uterus when you're carrying a baby, they are 2 different uterus, but it is for one person, and that's you. So when you're carrying, you can't be the same as someone who's not carrying. So you're looking at someone who's not carrying. It is already small in size. So this device is inserted inside. It's a simple procedure. People tend to fear it, but not painful. It's not. If someone is anxious, they can take something, but it is not necessary to do anesthesia. It is not necessary. So it's a device inserted in your uterus. It has strings. They always tell ladies, when your man feels the strings, you go for review. I can call it a review, but you're supposed to shake its position. He's not supposed to feel them.
But is it? I didn't think it was even possible for someone to feel the strings.
No, but the strings are out. Which strings?
Like
the outer.
The strings, anyway. Some men are long. Some women are also short.
Yeah, that's good. Yeah.
The walls are very short.
The length in between.
I know.
Because sometimes when, last time we're talking about, sex and stuff, whereby you feel the man in your throat. Like literally.
So maybe the man is probably longer than you. I really don't know how you feel the man in your neck, but probably.
It passes from your vagina
and then he reaches your neck.
Like you feel as if you're being choked. Yeah.
You tell him to stop,
Yeah.
That is beyond. So anyway, the IUD, if inserted, they tell ladies always, if you're having your period, you have to check your pad before you discard it. Because that thing may go in your pad.
Out,
Can go in your pad. Then tomorrow you come and tell us you conceived. Come, the thing is not there.
It's that small, you mean that you can't even notice it?
You can if you look at your pad. But not something that's going to crush you when it's coming out, you get. So during periods we are something is coming out of us. Yeah? I know some people get the cramps and all that, so it is sometimes you can't even take portion of you get. So we tell them you shake your pad whenever you're going to discard it. Then whenever, maybe if your man tells you I've started feeling it, you go.
He will be like,
something is making you a little bit. There's a foreign object inside.
There are strings.
It can be felt.
Let me tell you, that canal, the vagina canal, it is lubricated first of all. So imagine having strings in there.
So you feel something,
and
some
of
texture,
course the man is
different texture.
It is a sensitive thing. The man will always feel it in case it is. You get, will always feel it. But the good news about the IUD, people, you're looking at the hormonal methods. We didn't talk about the side effect. The hormonal method that as causing low libido, those things. With IUD, it is the reverse. Yeah. The reverse is
every day, like a battery.
So if you're having the issues with your libido,
come talk to me about it.
You're good.
I should try it. Only for libido purposes.
You girl, eh?
And
a man is going to be like, hey.
The other point I forgot, IUD can also act as an emergency contraceptive.
Oh.
We are looking at 72 hours after sex. Of course, when you miss an emergency pill, either you be ready to carry your pregnancy so in case it happens. So if you realize probably you had unprotected sex and you think you were not in your safe days and you want to take caution, you can place an IUD there. Within 5 days,
But then it is a non-hormonal one, so how does it stop a pregnancy?
Blocks the baby from entering. Remember that it has to move from the tubes, no?
Oh, that is
Yeah.
if at all the sperm hasn't yet reached the...
You're looking at 5 days period.
Possibly, where does fertilization happen? In the fallopian tubes?
No.
Where?
Oh, in the...
Anyway, if it happens there, then you're going to
Ectopic,
exactly.
Yeah, because now
So-
your tubes are so small and something
Yeah,
is
exposing
growing, so-
ignorance.
For me, I know it happens in the ovary, maybe.
Yeah, no, I mean, at what point does the egg meet the
You
sperm?
guys, the ovaries,
The ovaries release the egg.
so the ovaries, and this is too much science.
But we need to know the science.
Yeah, we
So
need to know.
make informed
implantation
decisions.
takes place in the uterus.
Exactly,
That's
yes.
when your baby gets attached to the lining of the uterus.
But
And then
Fertilization.
it is still in the same place.
Really? So how does the 5-day thing happen?
So we are looking at the hormonal, this normal copper IUD. You're inserting it 5 days before.
Yeah.
The baby implants in the uterus.
Yes.
The copper IUD is inserted in the uterus. Can two foreign bodies be together?
No.
One of them has to be
Of course,
expelled.
a baby can't implant when the IUD is there. Of course, when the IUD is there and you're pregnant, you lose the baby. You get.
But then
Like
how about
an
people who
abortion?
say I conceived on an IUD, which I find very, very strange.
Probably it changed position and they didn't notice that. That's why that.
Or it even came out and they didn't
Came
know
out,
that.
yeah.
It is possible.
Yeah.
So it is really effective, but we should be conscious about the positions because anytime it can happen, boom, child comes in.
So other than increasing your sex drive, what other side effects does IUD have?
That is a good part of it.
Positive.
It's increasing sex drive, but
Depends on whether your husband is around or not. It can be a good thing if he's around. If he's
so
blind,
if you're there going for
what are his
IUDs
problems?
and you're running long distance relationship, you meet once in a year, you suffer for no reason.
Exactly, those are his problems.
So there are always better methods for you if you're in that category. Yeah, there is always a better method for you. So IUD, we talked of how it is inserted. We talked about the strings and all that. The myths about IUD, you can say that because people have a bias about IUD. That's a good method. It's a very good method. First of all, it's non-hormonal. Since the hormones, we are getting something artificial inserting it in our body. So that's why we tend to get the mood swings. How a pregnant woman feels, you end up feeling the same. Imagine putting something because you're preventing pregnancy and then you don't have appetite for sex.
But is it possible?
Why
Like, do the hormones eventually stabilize themselves, or do you expect to feel that way?
You're adding almost everything.
I think your
There-
mood swings are
but
For me,
the-
I can't take those hormones.
No, but
things.
some side effects are minor. They happen for short.
Because me already, my natural hormones mess me up enough.
If you
So
can
imagine adding on.
if you can handle the bleeding and the spotting and the what, then you go for it.
Yeah.
They are good methods.
Okay.
So what other non-hormonal methods?
Yes. What
are
other
there?
non-hormonal methods are there?
Other non-hormonal methods. We shall look at barrier methods. Of course,
Barrier.
condoms. Yeah, condoms.
Yeah,
They are
yeah,
non-hormonal. You just putting a
The
barrier.
boring ones.
Yeah, they're boring.
But is it not the safest? Because you also mentioned STIs, STDs.
And now, as I told you, everything has advantages and disadvantages. So looking at a condom, of course, the men will tell you, I'm not feeling anything.
There is
But
no
then-
That's why I'm not feeling.
Saskunyama is not there.
That's why I'm
then,
not feeling.
but the other side is protecting you from STDs.
Yeah.
You get it?
Yeah.
So you're not conceiving unless you're so rough and then there's something bursts in the middle
Yeah.
there. You know, some people can have that rough sex, but then you're protected.
Yeah.
No pregnant, no STIs, as in you're just safe.
You
So
basically
leave
are
alone
living
Saskunyama
scot-free.
and focus. What do you want? Do you want to
Yeah.
conceive? Oh. Do you want to get the diseases? People go out with people that have not even checked for their status, really.
Yeah.
And you can't do the rubber because you want Saskunyama, really. So it's not
Short time
necessary.
pleasure. How many minutes? 5 minutes.
No,
10
it
if
costs
you
your
like.
life. It is really short. So that's also a non-hormonal method because it doesn't carry any hormone. Yeah. As well, you can also use the female condoms. I've not tried them out, but they are there on market. If you want to try out, they are there.
Don't they escape and enter your uterus?
Me, I think it may just enter.
Me too.
They can't.
For me, I think
can't.
they
They
are-
have a cap it covers.
How wide is the cup? Does it stay outside and real spreads out and you can feel it?
Next
Or it goes up to the bum and it's up here.
I know whether you pull and you hold it.
Next time we shall have a specimen probably. We need the female condom here, and people need to see this. Yeah, so that people have that phobia for what if he does this, even for the male. By the way, the condom can slip and enter.
It enters you also, yeah.
And it doesn't come.
It enters you, yeah.
Like inside up your uterus.
The condom has never entered me.
And do you need
You have a testimony here.
to do a procedure?
It comes out.
It comes out.
How did you bring it out?
It came out. I don't know how, but it
I
came
don't
out.
think it entered your uterus.
It took a
then.
day.
It took a day.
Not the uterus, but it
You were
entered
very
the vein.
comfortable. What people do, those niggas, they're always strong. Do this, I do this, then you remove.
Oh, I had to first wait it out.
You do what?
Because the V
Because
can clean itself.
sometimes this sex might be probably you're having it with someone who maybe is not yours, probably the married man or something.
Yeah,
like
not
that.
yours.
Yes.
You borrowed a man.
You borrowed a man for one pleasureful.
Yes, you borrowed a
afternoon
man.
day
So
or morning.
anything, ideally, of course, you're supposed to go to the hospital for removal because of the anxiety you get. But then this is a man, you're like maybe hiding. You get it's like you're eating things illegally, so you have to do it from there. What do they do?
Open.
So they fist you, like fisting.
You're
They
joking.
they insert their fist.
fingers.
And-
It's so
Fingers.
aggressive. People do
But
it out
if it's
there.
going up to the uterus, babe, it's not just a
Uterus.
finger.
You can't enter your uterus.
But you can't enter the uterus.
It can't.
Hey.
That's a different thing.
But if it can't enter uterus, why the heck am I going?
Vaginal
to the
canal,
doctor?
you can't comfortable.
No,
It came out.
I can pull it out myself. Why should I go to a
Just
whole
go squat and
doctor?
it comes
Imagine,
out.
okay, you guys,
You
I think for us,
contract.
we've had all the experience, but imagine a 14-year-old is having illegal sex outside. I mean, the parents are not aware of
Yes.
this. They are trying it for the first time, and maybe they heard of sex because, I mean, of condoms, because they used to come to schools, primary, and they teach us condoms and all that. So they have that idea. And even they study these things in class.
Exactly.
And nowadays, the kids watch porn.
So they are trying.
go online
They are
as
trying it on with a condom on, and by mistake it goes inside. Do you expect them to go to the hospital? How will they start?
I hope
You
they
shake,
watch
shake,
really
shake,
kindly. You
Maybe
contract
you can
those
tell
muscles
us.
Like a
until the
bottle,
thing comes out.
whereby they tell you shake,
Number
shake,
one,
shake,
these
and
guys
go
are
on.
anxious. Anxiety is there, so
Yeah.
how will you tell your mother you have a condom inside you?
Hey.
It is impossible. So us, or you, the
adults or the
I know,
experts, yeah.
you can do it with this, but you can sleep and enter.
Yeah.
So there won't enter, of course, is protection there.
Nope. You're no longer protected in
So
that
what do we
sense, you're
do?
not.
Go to the
You
hospital.
start
You
saying
see
your
that
prayers.
So you pray as if you went there with God. So if
So
it
God,
goes,
if you
of course,
forgive me this one
it
time,
says to be
I will
safe
never-
sex.
Yeah.
It says to be safe sex, so we have to go for those other options. You can choose to go for emergencies. Those other options, they'll be the next thing on board to think about.
Okay, so
There's something we mentioned also about the diaphragm. Is it also one of the?
It's a barrier, sub-barrier.
barrier.
method, yeah.
Can we talk about
how
it
does
briefly?
it work?
It's
Is it hormonal or
no, it's
non-hormonal?
non-hormonal. When you
Okay.
say barriers, something that, okay, the non-barrier method is a condom. Let's use an example of a condom. When a man has it on, that means his sperms or semen, it will not enter the woman. So there is a barrier. That's why they give it that name, the barrier. So whether it's the cup, diaphragm, female condom, what is it stopping, wherever? Because here, with a female condom, the man is releasing. But then it can't still enter because you have a
enters,
barrier.
yeah.
You get, so they are non-hormonal. But they just stop the contents from entering.
From going through.
Yes.
Okay.
That is how they work.
Okay, so we have looked at the hormonal methods and the non-hormonal methods. I think we have the permanent methods, right?
Most preferred by men who have children everywhere.
No, those are the ones who don't even want it the most.
Wow.
Those are the ones they don't even want to hear.
I
it.
wish we could pose this question to men. Can they really ever think of
Exactly.
doing
A man tells you, you know what?
You know,
For me, I'm done with
even if they have
with
10
kids.
children.
You tell me, okay, why don't you go and cut it permanently? Eh? What?
It even sounds to be an abomination.
Exactly.
What are you telling me?
Exactly.
Cut what?
It's like as if it makes them less of a man.
And looking at most family planning methods, it's us ladies getting the burden.
Yeah.
That's
So
true.
if we get somewhere where men are engaged, they should, but they don't.
They don't, of course.
They don't. So looking at the
permanent.
vasectomy. It's one of the permanent methods. They cut the ducts. Let me use it's like a tube of the man. When a man is going to have sex, sperms and semen, they are two different things.
Oh.
So you can have semen without sperm and semen with
So
sperm.
they still ejaculate.
Exactly.
They
can
do.
have
And the
their
mucus
sex-
still comes out.
They have their sex normally. The only thing is the semen doesn't contain sperms.
They be shooting blanks, basically.
Exactly.
That's
So-
why shooting blanks comes in.
So you enjoy the shooting of blanks because this side the woman is not on any contraceptive method because you're much aware that your man is blocked. Meanwhile, he's still active. He's engaging very well.
So it doesn't lower down their sex drive. Like, what are the side effects?
People, as you know, it is something I can call it to a layman's language. I can call it a surgery.
Yeah.
Our mindset also. Of course they go through pre-counseling sessions, but of course there is that phobia someone can be having still. So there is I always tell my patients there is something that you get sick because of your mind.
Yeah.
Psychologically, you don't allow yourself to get well.
Yeah.
You get,
Yeah.
So if you're such a person, then I'm relating to that man. So since he knows that they've cut down my tubes, he may not know which tubes and why and why. Of course, he knows why because he's trying to stop. But sometimes the sexual drive reduces because of their mindset.
So it's all in their head in most
Thank you.
cases.
So there's no
But it doesn't
scientific
affect-
correlation
it doesn't
between
affect,
the two.
doesn't affect. So
Okay.
the man can be active very well, but whatever he's giving you, there is no sperm. Like these guys who are infertile, that having fertility issues. Sorry, something to do with the sperm count. Those guys are sexually active. They produce the semen, but their semen
They have
lack the-
stamina, everything fine.
Actually, they satisfy you, as in, but the semen doesn't carry the sperm. So, and that is what we are looking at in order to form a child.
Okay.
So if you're lacking it, then some people have low sperm count. There are some figures they base on that is too much medical, but there are some figures they base on to say this person has a low sperm count.
Okay.
So depending, some men can't, they don't have the ability to make a woman
So
conceive.
they produce semen, but with very low sperm.
Yeah.
So with our vasectomy, we are producing semen without sperms because the ducts that connect they release when the sperm come and they mix with semen. So those ducts are the ones that are intact.
They're separate ducts from the ones that release the
Exactly.
stress.
So it mixes and then it gets into the
proceeds.
woman. Yeah.
Okay.
So since it's cut off, the physiology remains the same, but you just lack the sperms in your semen.
Makes sense.
Okay. So any other permanent method?
We have the ones of women. Tubal ligation. We have really very many options, women. But some women do it. It is a
And
surgical.
that's also a permanent one. Like you can't.
Exactly.
Irreversible.
It is irreversible.
Do they cut or they tie?
They tie.
So can't it be untied?
Those things are very, very small tubes. Very, very small tubes. And something to do with your body. If you look at this vein, if you've ever been in an operation, when someone is bleeding, during labor, when a woman gives birth, there is that cord. How do they do it?
They cut.
But before cutting, they first tie. You get.
Oh,
You
I
have to stop
thought they cut and then tie. and
They
then
first
tie
tie.
and they
You
cut.
don't cut before you tie. So the same applies to this. When you cut, we know the contents of the other side are not crossing this side.
Yeah.
But it's just a matter of cutting. We are not even cut. We cut after tying. You get. So as long as you tie, it's just okay. These are you get.
So
It's
it can't be untied. Because
Unless you want to tear it.
it's tying. So I'm
So
wondering
for
when-
women, since we are targeting your tubes, we can't just reach your tubes. Those are the modern countries. They have that laparoscopy. But for us here, that's why if a woman really is ready for that, maybe if they have done a Caesar on you, they advise they can do that the same procedure after Caesar, since your uterus is exposed. That means your tubes are also exposed, so they can really hit two birds with one stone.
Yeah. Instead of going through the surgery and all that.
Again,
Yeah.
so they remove the baby, and then maybe you also consented for that procedure. They do it at once, but it's permanent.
Yeah, it can't
It
be
is
reversed.
irreversible. It
For
doesn't.
clarity, when you said tubes are tied, which tubes are we talking about?
We are talking about the fallopian tubes of a woman. Yeah.
Okay.
Okay, so I know this is not related, but also a little bit. How about women who are not on any birth control method and have failed to conceive? What could be the problem?
We go back to the other session. I mean the first session we had. It is a lot when it comes to infertility. It is a lot. We can't just look at something, like we can't just focus on one thing. For example, the woman we talked about, the one who is having maybe short cycle. That means the ovulation happens so soon. You can call her infertile, but she's not.
Actually, I thought those who have short cycles are more fertile.
But
now,
then,
they are fertile.
In your
they are
periods,
fertile, but the target. When are we having sex?
Oh yeah.
Because
For
at the
you,
end of the
you're
day,
using
So the
regular-
conventional days don't
Exactly.
work. Yeah.
So at the end of the day, you're going to have your sex, but then you're not conceiving.
So they can try having sex in their periods, then they may
If the
actually
cycle
conceive.
tells you that,
But
please
the
do
thing
it.
is, how do
you want a
know?
child?
Okay, maybe that's a question for a guy.
It's after very many trials. Of course, you enter married 2 years, no child.
Yes.
You start alarming. You start looking out for the cause. You don't just sit. So in the process, you get to know. Of course, you as a person, you may not know, but as you go to the hospital, interact with a guy, any doctor you find, they can lead you to that. They can always lead you to that. Okay.
Wow.
I think as we end, I think it would be good for our viewers to know where they can go for the respective family planning.
Family planning.
Yeah, and also what to consider. You've talked to me, like me who wants to give birth maybe in the next year or 6 months. So someone out there, what should they consider, and also where can they go?
Okay. Like for your case, you want to give birth soon, I request or I advise you can go for the non-hormonal methods. It's better because they are easily reversible. Anytime you feel like I should get pregnant, you just remove it and then you're ready to go. So the ladies who have had children and then you feel you may have either one more child or, and you're not on that pressure that I need a child. They can go for hormonal anyway, but all in all, you look at the side effects. Can you handle? If you can handle, you're good to go.
And also
You go for
consultation, like you mentioned. Yeah.
Exactly. So some people go for pills, and for you're feeling that pill burden, that things I'll forget tomorrow, I'll do that, but they're okay with it. And it's working for them perfectly. You get. And then the length of time, because I can't be planning produce 5 years from now, and I go for pills.
Exactly.
I mean, they are
not
longer
feasible.
methods. So it's a lot to look on when you're choosing for a family planning method. Those are some of the things you should point out, should look at. Am I planning to conceive soon? How many children do I have?
Yeah.
You get.
So in a nutshell, do not do over the counter. Go and speak to a licensed medical practitioner.
Yeah.
Over the counter in terms of pills, but a method like IUD, you can't get it over the counter. You have to go do the consultation. You have to interact, and probably you come out with a solution.
Okay.
With your medical
The injection you can self, like you can just go home and.
Cyanopress people do, but for the injector plan, I don't know. I really don't, but it is supposed to be done by a licensed, like a medical practitioner. Because do you know the muscles you're targeting there? Okay, if I tell you inject your arm, do you know where exactly we inject? You may inject here. We have nerves. If you affect your nerves, you may get permanent, maybe lameness or disability for no reason because of just an injection. You've heard of children who have maybe they are not moving currently because of an injection. Probably because of the position. So it's not a matter of they told me it's an arm. If you inject the arm, it is all. No, you go get it from a safer place. Yes.
So where are these safe places? Does the government of Uganda in particular give free such services for free?
Exactly.
Everywhere, in every hospital?
Hospitals they do, health centers they do have family planning methods.
Okay.
Yeah. Where most times where there is labor, where there is a labor ward, they have to be family planning.
They go hand in hand.
They go hand in hand.
Okay.
So if a hospital, if at a health center for level we can really operate the labor ward. Why not a family planning clinic? We can. So the services are there. Feel free. Please inquire, ask. Don't just go for something because you had a friend use it and it perfectly worked for her. We are different people. So you may end up causing complications. Like for example, people with pressure, there are pills you're not supposed to take. So since this one is taking the pills, I think I need to go for that, please. People having stroke, the blood clots, there are things so please engage your medical personnel.
Okay.
Yes, it is very good and it is for your own good.
All right. Like Dr. Hilda has mentioned, it is for your own good. So if you are planning on should I call it enrolling? It feels like, you know, an enrollment.
Yeah.
But on getting onto a family planning method, please speak to your medical practitioner. And do not just go over a counter. Do not follow examples of other people.
Don't be popping pills.
Exactly, popping pills and everything.
P2,
Unless if it's a method that you had used before,
Yes, actually.
and you were already pre-advised by your medical practitioner. So we would like to hear comments, especially from ladies who are using family planning. What questions do you have? What concerns do you have? What side effects have you got, which probably we have not mentioned? And what has your experience been with the various family planning methods? So please don't forget to like, share, subscribe, and until next time, bye.